So let's check a few nutrition facts check. Yeah, some of them that people are going, oh yeah, this and that. Okay, let's take a look at this and see if this is for real. So a plant-based diet, it may, look what I say, may lower the risk from breast cancer, but there is not enough evidence for this. What they do know is that a higher consumption of plant food, so it's not about being vegan or vegetarian at all, it's about consuming more plant foods, is associated with lower risk of breast cancer. But this benefit is reduced by consumption of alcohol. So if you're vegan and you have a plant-based diet, but you drink alcohol, you're going to reduce the benefits of having a plant-based diet regarding the risk of breast cancer. Now, another study showed that women who ate the most red meat were 23% more likely to develop breast cancer than women who ate the least. However, it was made very clear that red meat is not the cause of breast cancer. So if you eat a steak, you're not going to get breast cancer from it, okay? But if you eat higher quantities regularly and consistently, you're going to increase the risk compared to women who eat less red meat. It doesn't say yes red meat and no red meat. It says more or less. And of course, if you're going to choose red meat, preferably grass-fed, organic, etc., etc. Not everybody can afford it. So if you're somebody who perhaps you have certain vitamin deficiencies, or you're told that you need to eat red meat, then you don't need to eat large quantities of red meat. Yes, but the studies, the science is saying women who eat more red meat versus women who eat less red meat. Yes, so it doesn't take out red meat, and it says it does not cause breast cancer. People who consume high levels of potassium nitrate is a very well-known additive that is used in processed meats, i.e. salami, Parma ham, York ham, all the meats, say a roast beef, is all being processed. It comes in a plastic package. They use nitrates, and particularly potassium nitrate as a food additive has shown, yes, that there's a higher risk of breast cancer compared to people who don't consume it at all. Okay, so here you can already make your notes and say, okay, well, maybe I take out of my diet processed meat that is in a plastic package with the additives, and I'm going to look at the ingredients, potassium nitrate, to see if it's there, and then I'm going to leave it out of my diet. Women with the highest dietary intakes of omega-3, okay, had 14% lower risk of breast cancer than those with the lowest intakes and tissue levels of omega-3. Now, omega-3 doesn't cure cancer. This is very important. This is not what the studies are saying. The studies are saying that when we have a higher dietary intake of omega-3, then it seems to lower the risk of breast cancer. Yes, so this is important. We're going to see where omega-3s come from for those of you who are also plant-based. And there is no good consistent evidence that milk and dairy products can cause breast cancer. So some studies have found that dairy might increase the risk of breast cancer, whilst others have found that it will decrease the risk of breast cancer. So the evidence is not there yet. We need more high quality studies. So if anybody says to you, oh yeah, drinking milk and dairies and cheese, etc., they're going to increase the risk of breast cancer, this has not been proven. However, dairy products, including cheese, and some cheeses are very high in fat and high in saturated fats. So indirectly, if we're going to eat foods that are very high in fats and very high in sugars, as we're going to see, they're going to make us put on weight and increase belly fat and perhaps even become obese, then indirectly it's going to affect our risk of breast cancer. The same happens with sugar. There's a lot of information online about sugar and cancer, but not much of it is based on scientific evidence. There's no evidence that following a sugar-free diet lowers the risk of getting cancer. And of course, we have to be very careful with sugar-free diets. We're not talking about this in this webinar, but don't forget that artificial sweeteners, lately there's been some evidence, some studies showing that may cause cancer. So sugar-free diet doesn't necessarily lower the risk of getting cancer, or that it boosts the chances of surviving if you are diagnosed. As a matter of fact, there's a lot of talk about that cancer cells only eat sugar and glucose, and that's what they thrive with glucose. But yet that is true. They use glucose as a source of energy, but they also use other natural chemicals that we produce, some of them part of amino acids that the body makes. So if we take out completely the glucose, in the absence of glucose, the cancer cells will actually use other sources of energy. Yes, so there's no proof of this. However, if sugar doesn't cause cancer, then what is the big fuss about it? Why are we worrying about this? And it is basically because in an indirect manner, there is an indirect link between cancer risk and sugar. Eating lots of sugary foods, the same as a lot of fatty foods, and if you combine both, even worse, over time can cause you to become overweight and become insulin resistant, both of which increase the risk of 13 different types of cancer, including breast cancer. So diabetes type 2, being insulin resistant, diabetes type 2 also increases the chances of developing breast cancer. And here we have both. Too much sugar, too much fat, particularly saturated fat. It's going to cause us to put on weight, particularly around the belly, perhaps even become obese, and that is going to increase the risk of breast cancer. So it's indirect. And as a matter of fact, being overweight and obesity are the biggest causes of cancer after smoking, and is meant to take over one day. Okay, so it may be being overweight and obesity may be the biggest cause one day of cancer after smoking, take over smoking. Again, this doesn't mean that everyone who's overweight will develop cancer. This is only part of the picture, but here is the information. Yes, so you have it available. Now, regarding alcohol consumption, I love this phrase. There is no safe level of alcohol consumption. I know that we've read about the polyphenols of red wine. They said, yes, there's the polyphenols. Polyphenols are very favorable for your health, but you can also get it from eating grapes, dark grapes particularly, and blueberries and dark tea. So there is no safe level of alcohol consumption. The risk of breast cancer increases with each unit of alcohol consumed per day. I see some of you already leaving the webinar and say, what, I cannot have my alcohol, my little glass of wine. Well, that's not the case. Again, as I said earlier, it's the full picture, but you need to know this. You need to know this because there's a lot of information out there saying, oh, women can drink this amount of wine and it's so good for us. Well, it isn't when it comes to the risk of breast cancer. Yeah. Increases with each unit of alcohol consumed per day. More than 10% of alcohol attributable cancers arise from drinking just 1 bottle of beer a day or 2 small glasses of wine a day. Okay? So this is serious, and for women particularly, it is a serious matter. So overconsumption of alcohol is extremely dangerous, and it causes high risk of developing breast cancer. And breast cancer has also been found to be linked and associated with very small doses of alcohol in some young women. So it's important to know. You don't have to give up alcohol right now, but this is something that you need to take into consideration. And to take out the I shouldn't drink alcohol to I choose not to drink alcohol. And you decide why you want to do that. Perhaps you're high risk, baby. Perhaps your mother had breast cancer, somebody in your family very close to you, and this is something that you're choosing for yourself. This is your choice. It's not about, oh, I shouldn't drink alcohol, because in that sense, it will never get anywhere, and it's only going to make you feel bad. You're going to say, oh, I shouldn't drink it, but I really want to drink it. But if you change that for I choose not to drink alcohol, that is a completely different formula. When it comes to supplementation, we also have a little bit of a facts check because there's a lot of things going on out there about over a gram of vitamin C every day, the omega-3s, of course, the vitamin Bs, etc., and also a lot of herbal supplements that are meant to be good for preventing cancer. However, let's make it clear here, supplementation means additional, not a replacement. Yes, so none of your supplements must ever replace food. Vitamin and herbal supplements can be dangerous and toxic and can cause serious side effects. They can also interact with your medication if you're taking any medication. Yes, so before you take any supplements, you need to have a complete blood test and decide with your doctor which supplements you need. And this is part of your self-care or choosing or empowering decisions that you're going to make. You need to go and see your doctor and have a discussion and say, hey, I am a woman. I want to reduce the risk of breast cancer. I want to have a full blood work because I want to find out if I am low in certain vitamins that may increase my own risk of breast cancer. Low vitamin D, for example. Yes, that could be. But before you go off to your herbal shop and buy, or your vitamin shop and buy vitamin D, you need to have a blood test because even vitamin D can be toxic, particularly also for the liver. And it's also connected with magnesium. So you need to find out. So on top of that, beware of alternative therapies. Please look for a qualified registered naturopath, nutritionist, or a dietitian, and you're going to know immediately because they're going to want to do a blood check. Now, don't trust anybody who's going to say to you, you need to take all these supplements without having made a blood test. Just by filling up a form, saying your symptoms, I'm losing my hair, I'm tired, I don't sleep well, blah, blah, blah. Oh, here's supplementation. Make sure that they want you to have a blood test and you combine it with the work with your doctor. So this is very important. We need to be intelligent, make intelligent decisions when it comes to women's health. Yes, and there's a lot of health magazines, there's a lot of health websites, there's a lot of people giving out information, but you need to empower yourself, making your own decisions, and go to people who know. Go to the qualified therapist, to your doctor, combine them both. Integrate, yes, this care so that you can have the best prospects for yourself. So, going to the doctors, have you set a blood work, check also blood pressure and other health markers. Maybe in the blood test, you can check inflammatory markers as well. This is super important before you make any decisions on any changes that you're going to take on in your life. So as we're talking about nutrition, what does a healthy diet look like? And here is where the confusing things come. Is it vegetarian? Is it pescatarian? Is it vegan? Is it paleo? Is it keto? What is it? There's a lot of talk about keto at the moment regarding cancer cells, but none of it has been tested with real human beings. Okay, none of it has been yet. So the best thing that you can do for yourself is eat non-processed foods, i.e. foods without a label, or they're called whole foods. Whole foods, a lot of people say, oh, what does whole foods mean? So many people don't know what it means. It means food that don't have any additives and they are the closest to its original source. So an aubergine, it's an aubergine. Yes. A chicken is a chicken. Yeah. So that you can see a banana is a banana. Yeah. So it's not a banana muffin. Banana muffin sounds really healthy. Carrot cake sounds really healthy. It's really far away from the original source. That's not a whole food. Okay? If you cannot pronounce the ingredient, your body cannot either. I love this. This is Dr. Nina Fuller from the Synthesis Clinic, and I love this. If you look at an ingredient and you go, but that's not absorb it, okay, no, your body is also not going to be able to absorb that out. Make sure that you have a balance on your plate of protein, healthy fats, and complex carbohydrates. Those are macronutrients, yes, that your body needs. Your body needs all of them. They need protein, we need healthy fats, saturated fats a little bit as well. Yes, and not completely the bad ones. We also need a little bit of saturated fats. They help us also to produce and develop sex hormones. So we also need it, but in balance. And complex carbohydrates, preferably rather than simple carbohydrates. But if sometimes you eat white pasta and white rice, but you compensate it with some oily fish and lots of vegetables, then there's no problem. Healthy fats high in omega-3, wild salmon, mackerel, sardines, flax seeds, algae, seaweed, chia seeds, to make sure that you have a good supply of omega-3, and choose extra virgin olive oil for the recipes where you're not going to heat up, yes, anything. So anything that is overcooked or burnt, as a matter of fact, is supposed to be contraindicated, and it may increase the risk of cancer and also of breast cancer. Avoid trans fats. That's anything deep fried or cooked in oil at high temperatures. That out, like fried chips and deep fried, even if it's deep fried vegetables, it's better not to do that because that has trans fats. And watch out for foods from a bakery. So a lot of the bakery products, like donuts, muffins, and croissants, etc., they're high in trans fats. Reduce the consumption of sugars. You don't have to do a drastic change, but say, for example, skip dessert. Take out the sugar from your tea from now on, or your coffee, and just reduce the amount of sugar, yes? And have the full rainbow of colors on your plate all through the day. So meaning green leafy vegetables, yellow peppers, red tomatoes or red peppers as well, orange carrots and sweet potatoes, lovely normal potatoes as well, and lovely red cabbage with that purpley color, and blueberries. So have the rainbow of the colors that has been shown by Dr. Tim Spector's studies that they do have a benefit, and they think that it reduces the risk of cancer. So hey, this is not a difficult thing to do. Just, yeah, rather than every day just saying I just eat potatoes, well, eat other things as well, from lettuces, tomatoes, carrots, and so on. Possibly you can fresh organic food whenever possible. I know that not all of us can afford it. Organic food in general has become really expensive. So I know that not everybody can afford it. So please, within your budget, maybe take out something else in your life. Maybe say, okay, if I'm not drinking soda drinks anymore, then I'm going to spend more money in organic food. Yes, that could be one choice. So if I don't go to the baker's, maybe I just go to the baker Sunday morning, but on Saturdays, I don't go. I'm decided not to buy any sweet baker foods. So then in that case, I'll spend more money in organic food, for example. And reduce the amount of salt. Now, this is a subject because there are some studies, not necessarily about salt and prevention of breast cancer, but there are some serious studies about how salt and high sodium diets can actually increase the proliferation and the growth of tumors in women who've already have breast cancer. So reduce the amount of salt. You'll do yourself a favor, because actually you'll also reduce your blood pressure and your water retention. So reducing the amount of salt, really, really, really important. That includes soya sauce that has a lot of salt in it. Remember, after we've learned about all of this, that if you have a medical condition, any allergies, or you wish to drastically change your diet, you must consult your doctor first, please. So don't take it on yourself. For example, high-fat foods, including avocado and olive oil, it might not be good for you if you need to have a low-fat diet, such as in the case of gallbladder disease. So consult your doctor first. Just because we say that good quality fats are good for you, it doesn't mean that you can eat them. So that's why it's really, really important that you go to your doctors and you say, okay, this is my medical history, and according to my medical history, can I do this diet? Yes, and collaborate with them and ask them.